welcome everybody to the Reconnection for Sport consultation event. I will just we'll get going. Just a couple of minor housekeeping points to get going. If you do have your video on, if you wouldn't mind just turning it off for now, we'll keep videos off if we can, just to make the meeting as seamless as possible and try and stop any lagging. At this point, I'll hand over to Katrina McAllister.
Thank you, James, and welcome everyone to this call, which we are really pleased to be hosting alongside Public Health, to try and work with you, the sector, to find a reconnection pathway back for sporting activity on the island. Hugh Raymond was very much hoping to join us and to be able to give the welcome today. He may pop in, and my colleague Elliot will let me know if that happens. However, I will cover his section for him until he gets here. So we're all really, really passionate about a return for sport. I think the sector has been exemplary in how it's conducted itself right from the start of COVID, and the day that we had to issue the instruction for all sport to cease is certainly going to be one that I'll remember for the remainder of my career, and something I never felt that I would ever be looking to do. So what we really want to do is discuss today the approach that we can take, the different variations that we need to consider when we decide which approach is best for you, the sector, what the next steps might be. The team's going to take you through some draft options and looking at how we may go about the relaxation of measures which are linked to other factors. And one of the things that we want to get across today is the interdependency between, for example, numbers, and if higher numbers means it means more mitigations, and lower numbers means less mitigations. So all of these sort of variables need to be considered as public health and government reach decisions about how they can safely return our sector. So from the beginning of this pandemic, Jersey Sport has worked in the background with public health in terms of giving advice to sports on, first of all, how to shut down, then the reconnection framework from the last time, the sort of safe return framework that we went through after the first lockdown. And you'll see a lot of similarities in what we go through today. And then obviously, unfortunately, into the second lockdown, and now trying to exit you out of that. Now, we're all passionate about sport, and we absolutely want to see our sector return. But I do know from speaking to many of you over the course of the last year, I think as a sector, we understand the need for that to be done in a way that's safe and it protects, both our own participants and the island as a whole. So we need your input. We want to take this opportunity to give you the opportunity to comment, to feed into us afterwards on what you've heard today, and inform the process, and to understand a little bit about the toing and froing that we do on a daily basis. And I don't joke, it is a daily basis with public health. And I'd like to thank Martin and Steve for everything they've done to help us, try and get sport back. You'll be able to hear directly from us, and you'll also be able to put questions in the comments box. My colleague Elliot is working away in the background, so he is going to sort of look at the comments that you're submitting, and then most of the time at the end we want to get through the presentation quickly so that you've got plenty of time for questions. Elliot will group them into sort of similar type questions. Anything that we don't get answered, we'll try and get feedback to you after the fact. So thank you very much, and I'm now going to hand over to James Tilley, who's going to take you through how we're going to manage the meeting. So thank you.
Great, thank you, Katrina. So, yeah, my name's James Tilley. I'm the head of sport at Jersey Sport, and just some other key introductions. You've heard from Katrina. She'll have an involvement later on as well. We've got Martin Knight here, who's the head of public health policy. We've got Steve Harvey, who's a strategic policy officer at the government of Jersey, and Elliot has already been mentioned, who is in our team, Children and Schools Manager, helping facilitate the meeting. So I'll just quickly touch on the agenda. Now, the intention is to skip through the journey for how sports guidance is developed and approved. We'll share with you some draft options for a phased return for all sport, and we want to get to that as quickly as possible. And we also want to create as much time as possible for questions. So I'll move straight on. We really want to hear your views. This is a consultation process. Everything we're sharing is draft and subject to change, and we need your input. So today, we're focused on the next phases for the reconnection of sport. We will assume that you're already aware of the current guidance and announcements, including outdoor sport numbers increasing to 35 on the 8th of March, all being well. And we're also acutely aware, as Katrina's kind of touched on, that there's a huge degree of frustration amongst the sports community at the moment, particularly around retail, cafes, restaurants going back, while outdoor sport numbers and indoor sports still heavily restricted. So we will, the first part of this presentation will present the next phases. But if you do have questions, comments, please do feed them into Elliot through the chat, and we'll try and address as many as we can at the questions section. So we've got around 200 people registered for today, recognizing not everybody will log in. So we just request, in terms of housekeeping, we request you keep your cameras off, except the presenters. That's just to avoid distractions. You will remain muted. So on that, we've mentioned before already, questions through to Elliot, please. If you do post a comment in the chat, not everybody will see it, and that's just to avoid presenters being distracted, so we can get straight into the nitty-gritty of everything. Questions or points of clarification on the current guidance are best dealt with separately, remotely with Jersey Sport. Just get in touch with us and we'll help answer those around the current guidance. And please do consult with us. There will be, and we know there will be, lots of unanswered questions, lots of comments we're not able to get to today. They will be fed into the consultation process, and we will follow up after this call, because we also recognise that there are people who are not able to attend at midday on a Tuesday for various reasons. So we will follow up with that. So at this stage, I'd like to hand over to Steve Harvey, who's Strategic Policy Officer for the Government of Jersey, working in public health. Thank you, Steve.
Thank you, James. Good afternoon, everyone, and thank you for your attendance. My short input now is to talk about the background process, what goes on behind the scenes, so that everybody is aware of how things work. So on the screen, you'll see that at the foot of the page, we have consultation events, such as this one, where we offer proposals, options, possibilities up for discussion, and take account of the feedback and the views of the sector before developing more focused papers for the Scientific and Technical Advisory Cell, which is what STAC stands for. Most of you would have come across or heard of them. In terms of consultation events, we have this one here today and a further one planned for later in the week with another large cohort of the sector, which might be best described as those who fundamentally are involved with fitness and indoor gyms. Because in terms of the approach taken here, the whole of the sector is considered as one, and we don't have a separate process for both sport and everyone else. Once STAC are offered more details as to the approach being taken, they will advise ministers as to what they think is appropriate and safe and sensible, considering the entire situation. And they advise, and then ministers decide. And you probably have all witnessed the announcements that come out through press briefings and the media, where the ministers will announce what's happening next. Behind the scenes, those of us that are in the public health arena will be developing, again, often in consultation with colleagues in the sector, the guidance to ensure that there is detailed information available that provides adequate coverage of what's required to steer and guide and advise people on how they can safely operate and what they can and cannot do. And also, as well as the guidance, there is legislation in some cases which underpins everything, and the law drafting process goes on behind the scenes as well to ensure that where legislation is being used to manage a safe return, that's in place. I've made it all sound very neat and tidy. The reality is it's not quite like that. It's not an exact science. There are certainly some inconsistencies, and decisions reached, goes without saying, will never please everybody. And something else that compounds all of this is that we are, unfortunately, but realistically, in a position whereby we have to make universal decisions. We have not got it's such a dynamic situation that we haven't got the capacity to develop bespoke guidance or bespoke approaches for particular elements of any one sector. So we end up with a sector specific approach, which we recognize is a blunt instrument, frankly, and means that the unique nature of a particular setting or a particular activity or a particular sport may be disadvantaged when considered against another activity or sport. But we just are unable to drill down into providing bespoke guidance and legislation and advice to each and every individual. You obviously are passionately involved with the sports sector and your particular element of it. And as Katrina touched on earlier, everybody else in every other sector who we are working with share that passion with regard to their own particular individual interest area, whatever it might be. And I sound a bit like an apologist here. I'm not seeking a sympathy vote, but we have a very small public health team that are stretched most of the time to get the guidance and the legislation and the process that I spoke about at the beginning of this running smoothly, and we just haven't got the additional capacity or resource to do much more than that, to be honest with you. However, we are all here with one shared objective, which is to reopen sport as swiftly and as sensibly and most importantly as safely as possible, and that's the focus of the rest of this presentation. So I'm going to hand back to James now, and he'll take it forward.
Great, thank you, Steve. So I just wanted to touch on very briefly the type of factors that will impact the way in which you return to your sport, the things that can change and that are built into the guidance that's developed. So on the screen now, I'll just very briefly run through those variables. So we look at indoor versus outdoor. We all know that outdoor presents a lower risk than indoor. We look at gatherings, and within gatherings, we look at the gathering numbers, both indoor and outdoor. Concurrent events, so that's events running at the same time with mitigation measures, again, indoor and outdoor. We look at waves. Now, where we've put waves, we mean wave starts, where a group of competitors or sports people, athletes, a training session or event may start, and then later a separate group start, and they go off onto a long course, for example, a round island race or something equivalent, or a smaller venue but with lots of space. We look at spectators as well within the gatherings. Then we move on to distancing. So we're talking physical distancing here. Within distancing, we have fleeting contact, so different types of contact, close facing contact. We've got the default 2 meter, 1 meter physical distancing, and primary school age bubbles which allow primary school age children or younger to not physical distance for their particular activities. But there are strong mitigation measures around that and guidance to follow around not letting bubbles change too frequently and that sort of thing. Then we look at aerosols transmission. So this is how the virus spreads. Looking at masks, we look at intensity. So this is indoor activity intensity levels. You'll see that's highlighted in red. We'll come back to this. We're all very familiar with, well, since the start of the pandemic, we've had restrictions on high intensity indoor activity. That's not been permitted since March last year, but low to moderate intensity indoor activity has been. We'll come back to that point. Ventilation is another key factor in aerosols transmission. Then we look at the duration of the activity, any shared equipment or shared areas, and obviously the vaccination program has a big impact on all of these variables. Now, what this diagram fails to illustrate are the interdependencies between each of the variables. So they are completely interlinked. Changing one variable, so for example, allowing high intensity indoor activity, is likely to mean more mitigations, more measures elsewhere. So where do we look? That may mean, if we allow indoor high intensity, it may mean that the government ministers and STAC decide that actually we can only have a certain number for indoor activities because there's an increased risk. So it's about balancing the overall risk associated with all of the measures. So relaxing one area often has an impact on another area because it's taken in the round. These all need to be considered when looking at the phased return for sport, and we will come on to options for all of sport returning and the phases associated with that. And the decision makers need to be satisfied that there are significant mitigations in place to allow relaxations to happen. This diagram is a snapshot. It's a working document that we use on a regular basis to focus our discussions. So the color codings are related to timings for when we think certain relaxations may be coming in. But I'd just like to touch on the indoor intensity. So just like to share our thoughts around the process for considering that as a variable. We're all very familiar with low to moderate intensity being permitted and high intensity indoor activity wasn't permitted through 2020. So there are pros, there are advantages to restrictions on high intensity activity, indoor activity, and it's what we've done before, so it's relatively easy to understand. The risk assessments are already in place, so we can pick them up and run with them. There are potentially lower mitigations involved. So if we have a restriction on high intensity, it may allow greater numbers indoors, as an example, and it can support risk reduction and community spread. There are also reasons to not have high intensity or restrictions on high intensity. So effectively, when indoor sport comes back, to not have any restrictions on intensity levels. And the reasons you may take that approach is the risk mitigations imposed may be too high or restrictive. So gathering numbers or greater physical distancing. It's not popular with some sports, restrictions on high intensity. It's really hard to define and enforce. It's very individual and subjective. It's not possible to write into law, so there's a greater reliance on guidance. We think Jersey's quite unique in this approach. There's limited case evidence to prove that it's a higher risk when population spread is low. And there are political views that it may not be an effective mitigation factor. So what we'll come on to now are some draft, I say draft, this is a consultation exercise. So what we're about to show you is completely subject to change. A couple of options for a phased return to sport. It is a pathway to the return for all sport. It's not a definitive list that STAC or ministers will necessarily approve, particularly all in one go. So it's possible that what we're about to show, ministers and STAC may choose to bring in easing of restrictions within a phase at different times, and it's possible we'll see some staggering. So we're presenting it in a very simple format, but what will happen, we may be slightly different, but this is our proposal that we're putting forward, that we've worked out with public health so far to date. And there are two options being presented. One with no restrictions on indoor high intensity, which may attract higher mitigations or lower gathering numbers indoors. And the second option is low to moderate intensities relaxed first indoors, with a view to high intensity coming in the second phase. So this is a consultation process. We do need your views, and I'll share the phases. You'll see we've proposed four phases, and I'll get straight into the detail of them. So what I'll do is I'll just dive into phase 1 and phase 2 of this first option. This first option is the option with no restrictions on high intensity activities. So when indoor sport comes back, any intensity is permitted. This is the option we're exploring here. Now you'll see the dates. We haven't been able to provide specific dates. This is through direction from public health colleagues, and as we know, there are very few timelines related to things at the moment, but we're thinking the indications we're getting maybe earliest mid-March. Now in this, for the next relaxation of measures related to sport over and above what's been announced already, you'll see the proposal in this option is outdoor sport remaining largely static around the 35 when that's introduced for adults on the 8th of March, or increasing to 40 as per last year. So that's the current proposal and thinking. Just on the numbers, so where we've got brackets there, they're the potential options for numbers. Now we don't know, and we're not able to decide what those numbers are or should be. STAC and ministers need to consider that across all sectors and all the unintended consequences, etc. So that will be decided by them. However, what we need from you is, if the numbers increase to 40, what does that mean for sport? Does that work for your sport or does it not? So when the ministers and STAC are making the decisions, they can do that in an informed way. So they know that if the number increases to 40, that will allow XYZ sport to get back to operation. It works relatively well for them, but ABC sport, it doesn't really work. So that's the level of consultation we need from sports now as to what numbers do work and what the consequences are for each number, gathering number. We'd like to see indoor sport come back, and we're, I guess, being realistic that the options there are 10, 20, 30, 40 for indoor sport. There's a proposal that staff, volunteers and officials are treated in addition to the gathering numbers for activities. So you'll see there we've got staff, volunteers, officials at +0, +5, +10. We're not quite sure what will be decided, but we'd like to see that considered in the next phase. Spectators remain part of the sports gathering. Now that's in there because our focus has been on getting sport back, and spectators to come at a slightly later date. We'd rather see more sport back, or as much as possible relaxed for sport, and then spectators to come, which we know is an important part to lots of sports, and parents watching sport, their children doing it and that sort of thing. You'll see all indoor activity intensity levels, which we've covered. Primary age and younger bubbles, so allowing those children to not have to physical distance for their activities. Wave starts outdoors, we mentioned earlier. You'll be unsurprised to see that pre-booking will be advised to help manage numbers, and 2 meter distancing except fleeting. You'll see that 2 meter distancing is in for phase 1 and phase 2. Now that's because the indication we've been given from our colleagues in public health, or friends in public health, is that the 2 meter distancing is likely to be around for a little while. So we don't know when that's going to go. So we've made the assumption that 2 meter distancing is the default for both phase 1 and phase 2. And obviously, if that changes, we will act quickly to update the options. Then that's phase 1. Phase 2 we see as hopefully an increase for outdoor sport, increase for indoor sport in terms of gathering numbers, staff, volunteers and officials in addition to gathering numbers. We'd like to see spectators considered as a separate gathering, which allows spectators, parents, etc., to not be part of the sports gathering number, but treated separately with mitigations clearly. Changing rooms and showers to open. We've got time restricted close facing contact with consistent partner here. Now, that may not mean much to some people, but this is focused on, I'll use a few examples like dance or judo, for example, where there are consistent partners for those activities that have close facing contact, provided the contact is time restricted and there are mitigations around that, allowing those sports to come back, again, with consistent partners. And then the 2 meter distancing is in there as well. So I'll just go back a slide to show what phase 3 and phase 4 are. You'll see that dates are TBC, and that they're a bit more vague when we get into phase 3, phase 4. But we'd like to see an increase in outdoor sport, indoor concurrent events considered at that stage, phase 3. And when 1 meter distancing comes in, again, I've mentioned that we're not quite sure when that will be. And then phase 4 is effectively back to normal. So that's where we see sustained close contact sports coming back, sustained close facing contact sports coming back, where the risks are really high. No limit to outdoor sport, no limit to indoor sport. So back to normality for sport. So that's the sort of draft option. Anything on here we need your views on. These phases can change, any of the mitigations within them can change, any of the relaxations can change. We need your input to this, particularly around numbers, so the gathering numbers for both outdoor and indoor sport, and the intensity levels for indoor sport. So I mentioned that we've come up with a couple of options focused around intensity. Option B, which is exactly the same as option A in terms of the relaxation of measures, except in this one, low to moderate intensity indoor activity comes in phase 1, with high intensity in phase 2. And I've already discussed the pros and cons of having this this format for relaxations. This model may, I say may, we don't know what will be decided, but it may allow, for example, greater numbers indoors, which I've touched on numerous times already, so I won't labour that point. So those are the options that we have come up with so far. We really welcome your views. I imagine the chat's lively at the moment, and I hope it is, because we can now move on to questions or comments. So please, if Katrina, Martin, Steve, you've seen anything I've missed or need to comment on, please interject now. Otherwise, we can move into questions. No, great. So the rest of this session is now focused on the questions. So Elliot, so these questions will be put to Martin Knight, who is the head of public health policy, and Martin will chair this session with questions coming through from Elliot. So Elliot, how are the questions going, and are there any themes coming through, questions we can pose to Martin, please?
Yeah, we've got plenty of questions. I think just before we move on to the questions, we've got Hugh Raymond with us. I believe Hugh just wants a couple of minutes just to chat to the room and such. So Hugh, you should be unmuted now and you should be able to speak to everybody.
Thank you. Hugh's not coming through yet, Elliot.
Okay. In the I've unmuted you, so once he comes through, we'll be able to move to that. Firstly, we'll go for a couple of questions. First question that has come in is in terms of why were sports affected so early in the lockdown, and can you shed some light as to how this decision was made?
Okay, thank you very much. Hopefully you can hear me coming through. My name is Martin Knight, Head of Public Health Policy. Thank you all for everyone joining today, and thank you for your obvious interest and support in moving us forward as an island to reconnecting sport. I think what we had in the early phases of the kind of reconnection phases as part of the safe exit framework in the early phases. Obviously, we were managing some of the early evidence base and shifting understanding around spread of COVID-19 in those early phases. There was early evidence of spread within gym environments, and obviously biologically plausibility around a number of the different variables that we talked about that was causing concern. So in terms of the safe exit framework, we said very similar things as we've said as we move through this reconnection phasing. Is that there is a certain degree of information around science based on risk, based on understanding, based on both some of the economic and well-being contributions of various different sectors in terms of those decision-making principles to allow us to open. And as we've said previously, as we move forward through this section, some of that sometimes feels there's inconsistency between different sectors and doesn't always feel as fair to certain sectors as well. What I would add is that as we came through the summer into autumn time, there was increasing evidence that when there's low levels of community spread, that it was increasing evidence and demonstrating that it was safer to start to open up elements of sport. So we had gone through the process with STAC as we headed into autumn. But unfortunately, at that time, when we started looking at some of the restricted sectors and restricted activities, so looking at things like kind of some of the singing activities, some of the sports, some of the nightclub issues, it became apparent as we were heading into winter that we were going to see increasing risk. We started to see our cases increasing, and the advice from STAC was that whilst we had moved into level 1, is that there was an increasing concern that opening up sectors as we were likely to be needing to dial back was going in the wrong direction. And interestingly so, in the Jersey second wave or the international third wave, been a really strong evidence that kind of indoor exercise and those environments were high in the risk factors for the spread of virus, particularly amongst new variant types, understanding that transmissibility had increased and increasing concern around aerosol spread. So the evidence base has continued to shift and evolve, as has the biology of COVID with with the introduction of new variants as well. So that's some of the underpinning rationale through the journey we've had as an island in relation to COVID, the restrictions, and specifically to sport.
Perfect, thank you. On indoor sport, we've had a couple of questions, re shooting. Firstly, what constitutes indoor sport? As you may be aware, shooting is a three-sided venue essentially, so quite well ventilated, and also in terms of direct sport and exclusive kind of tailored plans for the return for each sport, can shooting get back a little bit sooner is essentially the question, rather than indoor sport, which is obviously limited to 10. So what constitutes indoor sport, and will we be having specific sport plans?
So I think it's a really difficult, it's a good question, but it's a very difficult question to answer. I know that I only just received confirmation actually through Hugh Raymond, specifically for inquiries around this particular issue. I think some of the challenges we've had as a government and as a policy team is the ministers and assemblies' desire and wish to make sure that we're able to protect islanders further by being able to introduce regulations that gives powers to monitoring enforcement teams to essentially keep islanders safe. Sometimes in those instances, that's made things challenging for us. And my understanding is that we have to work within existing legal definitions with laws that are put in place. So certain buildings and establishments will be captured by that law. And to a certain degree, I mean, Steve Harvey mentioned earlier around blunt instruments. There is some elements of that becomes restrictive for us in terms of how flexible we can be in certain circumstances. But effectively, as Steve also mentioned, we are having to take a universal approach to providing guidance to sport. But not only that, that when we put guidance, when we specifically put legal requirements in place, that has sometimes broader reaching influences on other particular sectors as well. So we're being really cautious around that particular area. I will revert specifically directly to sports that relate to similar environments that the shooting club have mentioned. I haven't actually got to the bottom of the legal definition of what constitutes an indoor space, but I'm assuming it's been captured by that basis. So I will have to come back specifically on that particular issue. But once it's defined what an indoor space is, then we are captured by those definitions. You mentioned, I think, sorry, Elliot, about the reconnection stages and different times. I think Steve's mentioned earlier, universal approaches are the direction of travel. So guidance for individual sports isn't going to be able to be provided. We've got a number of different sectors that we're trying to provide for. But what the consultation will help us understand is by taking various different approaches, the impacts that it might have on individual sports, we can move that forward. So we'll be taking a number of those factors and variables that were mentioned earlier into consideration and how they might impact on individual sport areas. So as James mentioned earlier, your feedback today is really valuable for us in terms of understanding certain factors that might have unintended consequences in particular areas, and we can look to how we can manage those best possible for the benefit of the individual sectors and islanders more generally.
Can I just add to what Martin has just said in terms of the timeline question? The ministers have made clear that there will be a gap between each relaxation of circa 3 weeks. I don't think we've mentioned that before, but that's important just to underline. The reason for that is the need for caution, and ministers, Stack and others wanting to have an opportunity to review the impact of a relaxation in any one sector on the overall case rates and metrics around COVID before making any decisions about further relaxations. And you will be aware recently that the non-essential retail was about to reopen until circumstances made that required that to change, and there was therefore a delay. So while we understand and share the frustration that you have around wanting to have concrete dates, COVID doesn't behave like that, and we need to be constantly reviewing and monitoring the journey that's being made in terms of overall reconnection, which is why the 3-week time lag has been factored in.
Thanks, Steve. Really appreciate that. Probably worthy just to kind of mention the opposite side of the fence on there as well. So I mentioned kind of building and emerging evidence. We also know, there's a lot of known unknowns in relation to certain variables around vaccination and new variants. But if we don't see any newer new variants coming through, we are getting building information and evidence around the protective factors around vaccination and transmissibility for those people that have been vaccinated. Locally, we haven't seen anyone who's passed their first dose vaccination and had up to 80% protection after 2 weeks. We haven't seen anyone following that period go on to develop disease. So that's another important factor. So if we get more comforting evidence and information that we're managing the risks and we're not seeing those hospitalizations and onward to deaths in any potential additional waves. So we will expect to see increasing elements of transmission in some cases as we open up. But if we're protecting our islanders from disease and death, that will mean that the potential of being able to bring forward certain actions. So that's why both STAC's advice to ministers will likely be, if we set dates to specific openings, i.e. saying we'll definitely do this by June or May or what have you, it may well go in either direction. Things might need to be delayed, or it's quite possible that things might be brought forward. And the balance of risk and wellbeing benefit will always be played out as those decisions are made.
Thank you. We've got questions here around spectators. When can we expect spectators back to sports, and what is the current reasoning that they are not included as a separate gathering?
So again, the when is how long's a piece of string, unfortunately. The reasoning being we're trying to manage as far as possible where it's necessary to see household mixing, so mixing between different people, because we know that the greater opportunities that we have for people coming together and mixing with one another in all sorts of different environments, and outdoors is safer, but we're still looking to work through our approaches cautiously, recognizing that we don't want to put back the reconnection journey, allowing us to watch and understand each of the individual phases to see if it has had an impact on community spread. So the important part for sport is people taking part, being involved in it, and that's why the numbers would be focused in the first instance on allowing the playing of sport to go ahead. As we've mentioned within the reconnection focus and phasing, we'd like to see the spectating going forward. We recognise that engages a wider level of community, and where people are spectating, they're obviously supporting families and supporting one another and their clubs and teams. So that does have a benefit, but it's not as beneficial as allowing the playing of sport in the first instance. So based on that kind of phased approach, we're being cautious at that time. Similarly, we will be being cautious in wider events whereby we're allowing greater numbers of people to come together in single environments.
Thank you. There's been a number of questions around indoor gyms, etc. Cautious that we've got another consultation later in the week for those sectors, so we'll probably answer them later in the week. There's been a number of questions, notably from cricket, especially around the timeframes for off-island trips. When can we expect our athletes to be able to go off the island to compete?
So, sorry again, timeframes, they're going to be phased. Ministers are really keen to be looking at borders. There is, there's what much wider factors to then play into borders, because it depends on how our wider jurisdictions to pave what will happen within the common travel area. Will that involve wider international travel? So I think we're more likely to see greater flexibility around national travel, but obviously that's going to require policy as comfort for policy changes. We can't have teams going away to play and then potentially going back into 14 days isolation when they need to get back to work or school. So we need to make sure that when those relaxations happen, they are also happening at a time where it is appropriate, that the wider border controls, both nationally and internationally, have been opened up, so that we can manage that as safely as possible. So that's an even greater variable in there, because we have to work and acknowledge the pace of change that's happening in other jurisdictions and across other governments at the same time.
Yeah, thank you. A couple of questions in here around indoor swimming. Obviously, we've got children's school swimming back at the moment, but there's a number of questions of when will this be considered as part of this process?
So I think when we're considering, when we're seeing the phasing timelines, when we're talking about indoor sport, that should definitely include swimming pools. As you note, we've moved forward with our own reconnection process. We've already started. We started relatively early, kind of like in the new year, trying to make sure that children returning to school are as unaffected as possible, whilst also maintaining mitigations, keeping them safe. So we're getting children back to sport and exercise as soon as possible. obviously everyone will be aware of the wider contributions to mental health and physical health and diet, nutrition, etc., that those things kind of support. And that's the reason why we've been supporting children's sport to increase. Obviously, it's at greater group levels within education, because the controls there and children already being within those class bubble environments, and then some slightly tighter controls for the private provision of sport for young people. But I think actually, swimming will be considered as part of that indoor sport phasing.
Thank you. This is probably one for Katrina or James or Jersey Sport representation. During the first postponement of sport, there was funding available. Is this planned to take place again? Is the first question.
Thanks, Elliot. We are currently having that very discussion with government, and we have put a proposal to government requesting a second round of funding to support sports. We're very conscious that the first round, not exclusively, but had an impact on the summer sports because of the timing of it. But now many of the winter sports have experienced a really difficult period regarding membership fees, rentals that have to be paid, etc. So I'm expecting to have some word back from government this week, early next week on that. So we will communicate directly with you, as our contacts to let you know the outcome of these discussions. But it is our hope that we will have a second round opportunity for sports who are financially struggling.
Thank you. And then again, probably for Jersey Sport, what role do Jersey Sport play in issuing this guidance? How important will this consultation process be? And is it your ambition to make sure that Jersey follows the UK's stance of prioritising sport over hospitality?
Yeah, I think taking the latter bit first, then yes, it was interesting to see the UK's approach to this, and that's very much the similar approach that we've been taking behind the scenes, always advocating, questioning and asking why we couldn't go earlier, and having these discussions. And what I can assure you is that these conversations are constant on a day-to-day basis, and I'm sure Martin and Steve will vouch for the fact that mainly James, who's been James has been full-time on COVID matters pretty much since the start of this happening, working with public health, getting that guidance out to you as quickly as possible. So we would like to see it as quick as possible. I think the one that stands out for me in the presentation is the 2 meters. That's a difficult one because it impacts wider guidance, and the government is unlikely to go to 2 meters just down to 1 meter just for sport. But that's certainly a conversation we'd like to see, and how early that can be brought forward, because it has a major impact on quite a number of sports and the way in which you can play them. So we will be continuing these conversations, but what is really important is your feedback to that, particularly around about, for example, government may say, right, indoor sport can go back with high numbers, but the mitigations would be quite stringent, or would your sport actually function better with, say, a lower number and lighter mitigation? So that's the sort of things that we want to hear from this call. I think the difference this time round, and this isn't me, being critical, but as we came out the last lockdown, there was a very clear framework developed for government for all stages, and they've taken a different approach this time. So I think early on in the process, we knew what the exit framework was from the first lockdown, so we were able to feed into that process quite seamlessly and easily. This time, the government has been looking at it almost on a week-to-week basis and not putting dates against it. So what we've tried to do is get to this point today where we've pushed quite hard. I think Martin will vouch for us again on this, is to say, no, we need some kind of, even if it's a pathway and not a timeline, we'd like to give the sector some indication of how, if everything remains constant, we can get sport back. What happens in the process as it comes out of STAC and competent ministers, we usually literally round about the same time as the press conference is going to happen, and sometimes slightly before we get the draft guidance. In all honesty, we have a big role in writing that draft guidance. We get the final version, which has gone through the government processes, and then James works incredibly hard to turn that around as quickly as possible and get that out. Sometimes just as John Fondry is finishing speaking, sometimes slightly later. So we've got to look at that and interpret it and think, what does that mean for sport, and try and give you as clear guidance as possible. So that's the process that has gone through. But we will certainly be advocating for this sector, to get it back as quickly as we can. And the shooting example shared earlier with one open side and basically some really cold and very ventilated spaces, that's the type of thing that we want to push for, because we don't believe it presents a high risk. So these are the kind of conversations, the oddities that we pick up and say, look, this is actually quite limiting for that sport, without really any more risk than any other outdoor activity. So that's very much the conversations. Then we will move back to a phase where you will all be starting to think about, well, actually, might it be possible to run an event later on in 2021? So, today, for example, Two Sports have emailed us about events that they want to do later in the year. So please keep doing that. We will then feed that through to public health and relevant authorities to try and help figure out what the risks may be in planning for events further down the track. So I'll stop there, but we're definitely working very hard in the background on your behalf.
Thank you. Just cautious of time, last couple of questions. Can either Martin or Jersey Sport clarify the current indoor sport guidance? There's a bit of confusion around under 18s indoor sport and whether some clubs have been given exemptions to start this earlier than others.
Martin, do you want me to pick that up?
Yeah, sure. If you've got the information, I know Steve's been working on the same thing. Absolutely.
Yeah, so there is a current guidance which, as I mentioned at the beginning, is probably best dealt with individually, remotely, which get in contact with us and we can run through the details. There is guidance that does permit indoor and outdoor children's activity groups. So where 2 or more children are meeting for up to 10 participants plus volunteers and officials, and that are organising the event, and that can take place in sports venues. So that guidance is there. It's on the government website, and is also written into the various law orders. So any detailed questions around that, please do get in touch, and we will help advise as best we can.
Thank you. And then the final question is around waves and different sporting events. So is there an intention to have different guidance for off-land events such as sailing, or land events which involve vehicles or bikes?
Martin, did you want to?
Hi, yeah. So again, I think we've said what we try and do is make sure that the guidance that we release it speaks across various different sporting environments. So and I know this is where a lot of the relationship between public health policy and Jersey Sport is essential, because obviously engaging with the specialists who work on behalf and represent sport prevent us doing unintended and stupid things that I say stupid things that seem common sense but actually have a significant unintended consequence on another sport. So previously, when we were working through sport and wave events, we had the advice and the support of Jersey Sport to say, well, okay, this is what it might mean for a running event, this is what it might mean for cycling, this is what it might mean for sailing. So we do look at the impact of the guidance and trying to make things as flexible as possible while maintaining the safety. And that's the purpose of wave events, is so that recognizing when we have restrictions on numbers, that there is the opportunity of making events that work slightly differently, continue to work safely, or recognizing when they already do, which clearly a sailing event, people are in much smaller gatherings over the period of that event, just because of the nature of the sport. So no, there won't be separate guidance, but as ever, we'll work really closely with James and Katrina and wider Jersey Sport colleagues, and we test and interrogate the guidance on that basis. So we generally manage the opportunities for guidance that then the Jersey Sport colleagues are able to support individual sports through. Do I think that answers it, James?
Yeah, thank you. Yeah, I think it does, and we're fully aware of these types of issues that we present and discuss with public health on a daily basis. So we are trying to address these sorts of challenges as best we can within the guidance. So I'm very conscious of time now, coming up to 1 o'clock. So I think Hugh Raymond was around. I don't know if he is able to unmute and go on video to say hello.
Hugh, can you hear me, James? Yep.
Yeah.
Yeah. So Hugh, unfortunately, is having, he's emailed me in the background, he's having some technical difficulties with his mic on the device he's using, but he wanted me to just make a few comments on his behalf, which is to say he's obviously been listening intently. He is absolutely 100% behind working with government, advocating for our sector to go back. You know, he's got greater involvement now than I think sport has, you know, working on some of the committees, being in there representing sport as some of these decisions. So James explained that we feed the information along with public health that goes to STAC and competent ministers. Hugh now has roles in some of these environments where he's able to, you know, make the case in the room, and I think that's a real step forward in the right direction. So it's a huge shame that he's having issues and he can't you know, sort of talk to you directly, but he absolutely is behind us. We as Jersey Sport have a regular dialogue with you and him back with us, and we're sort of trying to work together to make sure that we all do what we can to get this sector back as soon as possible.
Great, thank you. So I've just put up on the screen there the consultation process. So please do email the coronavirus@jerseysport.je email address by the end of this week, so by Sunday, and can I make a plea to everybody, please, to keep the messages as succinct, clear and concise as possible. As you can imagine, we have a very limited resource, and dealing with some of the messages, long messages, become time consuming. So the more clear, the more concise we can make your views, the much more likelihood there is that they'll be well understood. And obviously we're here to talk to at any point, anytime, around the guidance for your particular sport. So please do get in touch with us. We're here to help, and we will always do the best we can. So at this point, I'd just like to say on behalf of Jersey Sport, thanks to everyone for attending, and thank you to Martin and Steve for all your hard work that you do for the sector behind the scenes, and for your presentation today as well. So thank you.
Thanks.
Great, and we'll end it there unless Katrina has anything else to say.
I think there's been a question asked as to whether we can share the slides or not. James, what was your sort of thought on that?
Yep, I'm really keen to share the slides. I think there will be people that weren't able to attend today, and it'd be good for them to see it. So it is our intention to share the slides, which I'll get onto in the next day.
Thank you, everyone. I think you know, just as one final comment, I am able to say at every turn to senior ministers, to anyone that we're talking to about the sector, how exemplary you have all been, how diligent you've been around your risk assessments, the hygiene processes, the taking of registers, and the point that we're making loud and clear to the government at the moment is we are a controlled sector, and we can and will act collectively to lessen the risk that comes from the playing of sport. So thank you all. Some of the work that you have put in as largely as a volunteer sector has been exceptional, and we would just like to thank you all for everything that you've done. So thank you, and we are and will continue to work very hard on your behalf to get the sector back.
Thank you very much. Bye, everyone.
Thank you, everyone.